Tell us about the Pearls course and the Gait course. What are they designed to do?
If someone has studied for a long period of time this method with Ed or many other manual medicine classes, this really is the course that puts the icing on the cake, because it allows the practitioner that comes to learn about the indirect, the direct techniques, the high velocity, the muscle energy for the indirect, the cranial, the functional, indirect, and even strain counter strain, and how to apply all the basic principles to those techniques so that you don't have to have all of these different systems, but it combines it all together. Then you can use them uniquely to treat each individual patient. It allows you to fine-tune your skills on sequencing, your palpation skills on blending, and any pearls that we have or wisdom that we've learned over our years of doing this type of teaching and method. For myself, 30 years, and for you, Ed, how long?
56 years. And what's unique about it, it's basically driven by the problems the attending clinicians have. So you can start out by saying, let's start with a cervical area, and you can review things. Then say, what type of patients can give you problems with the cervical area? And then out of that expertise, give them unique ways of how to address those problems. And it's really a problem-solving type course that really helps them to then take the skills they have and maybe be able to take them to another level when they can think the problem through in a little different way and find out there's other options and ways of thinking about it and applying the principles.
And then the Gait course?
In the Gait course, many times people, I found, you can effectively give them what appears to be an effective treatment and the patient still has pain. And when you check the low back landmarks and tests, everything can be normal. So you think, that patient's doing fine. And yet the patient reports that they've only seen a 60 or 70% improvement in their pain. And when they move, they still have a catch or some pain. And then what we started doing is dynamically testing these people while they were walking and palpating the sacral base, and then find out that the sacrum wasn't going through the normal pelvic mechanics associated with gait. And we found that when we then treated that, modifying functional principles to restore the gait mechanics, that many times immediately then the patient would say, now I'm 90% better, and that catch is gone, I'm markedly improved. And what I think was going on, that before I started doing that, after I effectively treated a patient and they walked out of the office, they immediately were walking back into their old pattern. Whereas when we changed the gait mechanics, then I think they're basically walking towards health. And the longer they walk many times, the better they get, the less frequently we had to see patients, and the effects of the treatment many times were a lot more long-lasting.